Hi everyone, welcome to AllAboutRx. If you're a Pharm.D student, you know that our journey involves a massive variety of subjects. We study everything from anatomy to complex pharmacology. But there's one subject that truly acts as the ultimate foundation for absolutely everything else we do: physical pharmacy. Today we're going to break down what physical pharmacy actually is and exactly how it connects to the core concepts of our field, like pharmacokinetics and pharmacodynamics. By the end of this explainer, you won't just be memorizing definitions, you'll deeply understand the why behind every single medicine you ever dispense.
Now let's be honest for a second. A lot of students get completely intimidated by this subject. Some even go as far as trying to bargain with their professors, asking, hey, since there are 10 chapters, can I just read 5 of them? But we really can't bargain with the science of medicine. It's not just a dry, heavy subject filled with equations. It's the fundamental reality of how molecules exist and behave. If we don't understand the physical nature of our materials, there's literally no way we can guarantee they'll safely treat a patient. So let's make sense of this together.
Here is our roadmap for today. First, the foundation of pharmacy. Second, defining the basics. Third, the Pharm.D life cycle. Fourth, why physical pharmacy matters. And finally, conclusion and next steps.
Okay, let's dive right into Section 1, the foundation of pharmacy.
We need to start at the molecular baseline to understand what we're actually putting into a patient's body. People often use the words drug and medicine interchangeably, but in pharmacy they're very different. A drug is a pure chemical substance, the active pharmaceutical ingredient, or API. It has an effect on a biological system, but it doesn't have a definite form. You can't just hand a patient a microscopic pile of raw chemical powder, right? But a medicine? That's when the drug is combined with excipients, inactive ingredients like binders, preservatives, or flavorings, and formulated into a specific dosage form. To make this relatable, just think about a standard bottle of cough syrup. The active chemical inside is the drug, but the whole palatable, measurable, stable liquid format, that is the medicine.
Moving right along to Section 2, defining the basics.
Now that we see the clear distinction between a drug and a medicine, let's actually define the science required to transform one into the other. Physical pharmacy is the formal study of the physical properties of these substances. We are literally applying the laws of physics and chemistry to understand exactly how drugs behave. Think about it this way. The brilliant physicist Stephen Hawking used the laws of physics to study the massive, cosmic behavior of black holes in the universe. Well, in physical pharmacy, we're using those exact same fundamental principles of physics, but we're applying them microscopically to study the behavior of molecules, their solubility, their stability, and how they react to their environment.
Let's see how this builds in Section 3, the Pharm.D life cycle. So how does microscopic physics actually translate into healing a human being? This is the entire life cycle of a drug. Step 1 is formulation, which is physical pharmacy. This is where we study the solubility, the particle size, and the physical stability of the drug. Then, step 2 is pharmacokinetics, or PK. Once the patient actually swallows that tablet, the body takes over. Next is step 3, pharmacodynamics, or PD. This is when the drug has reached its target and is now binding to receptors to create an effect. And finally, step 4 is therapeutic use. This is our clinical outcome. Do we cure the infection? Do we lower the blood pressure? It all starts right back at step 1.
Now, the absolutely crucial point here is mastering the difference between Step 2 and Step 3 because, let me tell you, it trips up students all the time. Pharmacokinetics, PK, is what the body does to the drug. It involves ADME, that's absorption into the bloodstream, distribution through the tissues, metabolism by the liver, and excretion by the kidneys. Conversely, pharmacodynamics, PD, is what the drug does to the body. This is the actual receptor binding and the resulting therapeutic effect. You absolutely must have the physical pharmacy properties completely dialed in for both PK and PD to work correctly.
And this brings us to Section 4, why physical pharmacy matters.
Let's pivot from theoretical definitions to some real-world clinical consequences. Take a look at this drug permeation curve. When a drug is absorbed, say through a membrane or the skin, it doesn't just happen instantly. You can see that initial curve right there, which represents the lag time. This is the time required for the diffusant to establish a uniform concentration gradient in the membrane before it reaches that straight, linear, steady state of absorption. The specific physical properties of the drug, things like its partition coefficient, its diffusivity, its particle size, these entirely dictate that lag time. If you alter the physical properties, you alter the exact speed at which the drug enters the patient's system. bringing it all together into some heavy clinical context, if you don't deeply understand physical pharmacy, you really can't understand why one tablet acts faster than another. I mean, the rate of dissolution literally dictates the action time. Furthermore, if you don't understand pharmacokinetics, you won't know why a patient with kidney disease needs a dose adjustment because their excretion phase of ADME is compromised. And without understanding pharmacodynamics, you just won't understand how to predict and prevent dangerous side effects or drug-to-drug interactions at the receptor level. Physical pharmacy isn't just a lab subject, it's the vital bridge between the research bench and the hospital bed. Finally, Section 5, Conclusion and Next Steps.
To wrap everything up today, physical pharmacy ensures that the transition from a raw chemical to a healing medicine inside the human body is safe, predictable, and effective. In this ongoing series, we're going to dive incredibly deep into all of these concepts, covering everything from kinetics to rheology. If you found this explainer helpful and you want to master the science of pharmacy, please hit that subscribe button to join us here at AllAboutRx. But before you go, I have a quick question for you. Do you personally find pharmacokinetics more challenging or pharmacodynamics? Think about it and let me know your answer down in the comments below. Thanks so much for joining me for this explainer, and stay tuned for our next topic where we'll tackle rheology and the flow properties of medicines. See you then!